Okay, we'll be starting shortly. We'll just wait for a couple more people to join, and then we'll get started within a few minutes. Okay, we'll wait one more minute and then we'll get started. Okay. Um, Thank you everyone for joining. So today we are at Gerotech and we are going to be presenting on healthcare and technology. My name is Jenna and I'm part of Gerotech as the Director of Internal and External Affairs and the coordinator of the online workshops. Tyler and Larissa, would you like to introduce yourselves?
Yeah, for sure. So thanks everyone for showing up. It's a pleasure to be here. My name is Larissa. Um, I'm a Gerotech member and the future president for next semester, so it's great to be here. Just to give a brief background on what Gerotech is, so we're USC's premier volunteering and research student org to serve older adults in the greater LA area. And we come from all different backgrounds, so all of us have like very different interests and majors, but we share the common goal of making the lives of older adults better through the introduction of technology. And yeah, we hope you guys enjoy this workshop, and I'll let Tyler introduce the other board members.
So just to introduce myself, my name's Tyler Pham, and I'm the future vice president of Gerotech, for next year, and I'm very excited to be a part of this presentation. And I just want to thank all of you guys, um, for, sorry, one second. I just want to thank all of you guys for joining this presentation, so we share the information with you.
And then would the rest of the presenters like to present themselves as well, introduce themselves?
I can start.
Yes.
Okay.
Oh, sorry, Grace, you go ahead.
Oh, no, it's okay. You can go ahead first. I'll go after you.
Okay, so my name is Beatrice. I am currently a member in the Geotech board, and then next year I'll be the secretary. And we're super excited to share a little bit about healthcare and technology to you guys today.
And then I'm Grace. I'm in charge of the internal affairs right now. But like I mentioned before, I'm also very excited to share with you guys some about healthcare and technology.
Hi, my name is Hannah, and I'm currently in charge of the finances and treasurer of Gerotech.
Hi, my name is Abby, and I'm the current secretary. It's nice to meet you guys.
Hi, I'm Steven. I'm currently a member of Gerotech. Super excited to introduce the content we're about to share today.
Okay, thank you, everyone. So today we're going to go over healthcare and technology. We're going to be talking about how technology is being used by patients, different credible health sites, how technology is being used in hospitals, and the potential future of technology in healthcare. So first, how is technology changing healthcare? So by integrating the use of technology in healthcare, we're able to increase accessibility to healthcare and to health education by making a lot of different resources available to everyone. We're also increasing efficiency by using different technology to kind of make the process of finding drugs or make the process of organizing different health records a lot faster. We're also able to streamline resources and streamline medical records by making them all digital. And we're able to kind of get started with personalizing medicine to each patient and their lifestyles and health choices. So we'll be going over how technology is currently being used in healthcare and how it could be used in healthcare in the future. So we'll be talking about different devices and apps that patients are able to use, how technology is being used inside an hospital, and the future of healthcare technologies.
There are many devices that can be used for patients or for health-related purposes. One of them is a smartwatch. First of all, there are a lot of health metrics that can be measured on a smartwatch. These include measuring heart rate, your daily step count, and monitoring your sleep quality. You can also use the smartwatch to set reminders to take your medications and also sync it to different health apps to track and monitor your health. There's also the fall detection feature. So, for elderly patients or those with mobility issues, many smartwatches include fall detection sensors. And if the watch detects a fall, then it can send an alert to a caregiver or emergency services. And there's also the emergency SOS feature. In case of an emergency, many smartwatches include an SOS feature that alerts emergency contacts or services, and this can provide peace of mind for the user and their family.
Other wearable health and technologies include medical alert bracelets or necklaces, ECG or echocardiogram monitors, glucose monitors, Oura rings, or smart clothing. So starting off with the medical alert bracelets, these bracelets contain important medical info like your health conditions that you have, allergies, or your blood type. Um, in case you're unconscious and a first responder needs to know what conditions you have in order to administer the correct treatment. These medical alert bracelets also have buttons on them as a means to contact emergency services in case of an emergency situation. The next piece of technology would be the ECG or echocardiogram monitor, which is shown in the top right image. And what the echocardiogram monitor does is it monitors the heart's electrical signals over an extended period of time so the data can be collected and sent to your doctor for diagnosis. The next piece of technology is a glucose monitor. So for those of you that don't know, diabetic patients have to check their blood sugar sometimes four or more times a day via finger prick, which can be painful after a while. So what the wearable glucose monitor does is it allows you to track your glucose levels constantly throughout the day. It only requires an insertion once every few weeks, so it could be a lot more comfortable for patients. Um, and then the last two pieces of technology, the Oura Ring and the smart clothing, mostly just monitor basic biometrics similar to how a smartwatch does, like your heart rate, heart activity, and your sleep quality. And smart clothing is still under development to ensure like comfort and functionality.
Yeah, so just going over a few of the types of health apps that are out there. We have four main categories that I'm going to talk about, which are medication, symptom pain trackers, health journaling apps, and stress management or mental health apps. And on the right side, I have two examples of each type of those apps that are available on the App Store. And so for medication apps, they're pretty much what they are. So they just send reminders and provide any drug interaction warnings to help users manage their medications over time. The symptom and pain manager trackers allow you to write down your experiences, your symptoms, or other triggers so that you can better manage your healthcare in the future. We have Journey and Dailyo, which are for tracking mood and activities over time, such as your emotional patterns and mental health. And then Calm and Headspace provide guided meditation exercises, breathing techniques, or even sleep stories to help you manage your stress and anxiety. And just a disclaimer, this is a quote from the National Institutes of Health, but it's just saying that when you're downloading these health apps, it's really important to make sure that you know who produced it and where your information is going, such as your email, your location, your personal information. It's collecting really private information, so before you're really using the app to its full extent, it's really important that you are comfortable sharing this information. And here's an interactive question. So what kind of health apps do you currently use or would you be interested in using? And feel free to type your experience in the chat and we can talk about that. My chart. Yeah, I've heard of my chart before. Mhm. Yeah, so my chart is just another type of health app. Medication allows you to see your test results, upcoming appointments, medical bills, price estimates, all of the above. Yeah, so these are definitely very accessible apps for you guys to use, and for a variety of concerns as well.
Guys, feel free to keep adding what you guys think in the chat, questions, comments, and we'll get to them either by the end or we're gonna keep answering them in the Q&A feature. So feel free to keep adding any questions. Right now, I'm going to talk a little bit about how to find credible health websites because there's a lot of health information on the internet, but we need to know what's reliable and what's not. So first of all, we have three sources which are the most recommended ones to find health information. So the first ones are always government websites. So government sites provide research-based health information. So for example, the National Institutes of Health, where it has medical research and clinical studies, or the Centers of Disease Control and Prevention that has disease prevention and public health updates. And these websites are usually going to end with a .org in their link. We also have medical and academic institutions. Those are going to end with a .edu in the end of the link. And these are basically university and medical schools websites that offer expert research. So for example, PubMed or JAMA Network, those are a few reliable examples of those. And then we also have reputable health organizations. Those would end the website with a .org. And those would be like the Mayo Clinic, which has really easy to understand medical advice. I would really recommend the Mayo Clinic. And then we also have the World Health, Global Health Data and Guidelines. So those would be the best sources to look for health information. But in the next slide, thank you. So I also have some tips for questions to ask yourself before trusting a website when we're researching health information. So the first one would be who owns or sponsors the site. So is it a government? Is it a university? Is it a nonprofit? Or is it a website that's trying to sell you something? Then also who wrote and who reviewed the information. Are they experts? Are they doctors? What's their expertise on the topic? When was the last information updated? So we're finding out so many new things regarding health and medical care, which we always need to keep looking for the most recent updates. And then also, is your privacy protected? I think if you guys were in our previous workshop, we talked a little bit about scams and that kind of stuff. So we talked about having your privacy protected. So always to check for your HTTPS and the privacy policy of the website. And then the last one that we also talked about when talking for scams is, does it sound to be too good to be truth? Because it probably is too good to be true. So does the site provide a miracle cure? Because those exaggerated claims could also be a sign of it that's not that reliable. And now, lastly, I'm gonna just share a little bit of the dangers of self-diagnosis and misinformation. The thing is that it's very important is that symptoms can be misleading. So many illnesses can have overlapping symptoms, and making self-diagnosis is unreliable. So a headache could mean something really big, but also something really small. So when we're searching this info online, it's very tricky and it can get confusing. And then also online info is not always accurate. As we talked about in the previous slides, anyone can post things on the internet nowadays, and not everything is based on science. So we need to always keep looking for those reliable sources. And then the problems with those with self-diagnosis and this misinformation is that it can delay proper treatment. So misdiagnosing yourself can lead to unnecessary stress or just doing the wrong thing. And then consequentially, it can cause panic. Misinformation can make a minor issue seem something really big, and then that's a necessary fear. So the 4 tips that you should remember from what I'm saying is fact check your health info. So let's use trusted websites. Be skeptical of extreme claims. Like if it sounds too good to be truth, it probably is. Check the source, who wrote it, when was last updated, what's the purpose of the article, and then lastly, and most importantly, always talk to a doctor. Only a healthcare professional can provide an accurate diagnosis, and you can also ask for your doctor for tips of what websites to use. So that's a little bit about that. Thank you so much.
Okay, so now we're gonna move into just talking more about technology in hospitals. So go on to the next slide. We're first gonna talk about telehealth. So what exactly is telehealth? This is basically a way that you can help manage your healthcare needs without having to leave your home. And you can also make it easier to choose from a wider range of healthcare services and specialists. So there's a lot of different ways that you can use telehealth, and that includes like video appointments. So you can talk to and see a healthcare provider just like a regular visit. You can also do it through phone calls, so you can speak with your provider by using your telephone. There's also secure emails or texting where you can send secure emails or text messages about what you're going through, all the conditions and symptoms that you might be facing. And you can also share any images or any test results with your provider, and they can do the same for you. And then finally, there's also remote patient monitoring. So you can use technology, as we mentioned before, like the watches, to keep track of any health information like blood sugar or blood pressure or heart rate. And then this information can be shared with your provider. And then moving on, as mentioned before, telehealth makes it much easier and faster and more convenient to get medical advice from home. So there's a few key ways that telehealth can actually help manage your health. So it allows you to talk to a professional about stress, anxiety, depression, or substance use issues, all from the comfort of your home, so you don't have to go into the doctor's office. And you can also review any lab tests or x-rays or diagnosis online rather than taking that extra trip to the doctor's office. And then you can discuss those results with your provider virtually. And then for a lot of conditions that have some symptoms that can expose others to those symptoms, like rashes or infections or like a cold or a flu, a virtual visit is really beneficial in determining the best course of action without actually having to go out and expose anyone. And you can also assess like those skin conditions through video consultations or by uploading photos for your physician to review. Telehealth also makes it a lot easier to manage prescriptions and get refills and discuss any side effects or concerns that you might be facing from those medications. And then for after surgery, telehealth can also be used to follow up and check in to see how you are recovering, reducing that need for the extra in-person visit. And then finally, there's remote monitoring. So for any chronic conditions like diabetes or heart disease, smart health tools can help track vital signs and send that data to your provider, like we mentioned above. And now, how do we exactly schedule telehealth? So it's very simple and it can actually be done in a very few steps. So you should first start off by calling your healthcare provider's office and asking if they do offer any telehealth visit. And then the staff there can actually help you set up an appointment. If that doesn't work, many clinics and hospitals also use an online patient portal where you can schedule an appointment yourself. So you basically will just select a date and a time that works best for you, and then the office will confirm your appointment and provide instructions, such as if you need a specific app or any login details. And then you can prepare for your visit before the actual day and time of it by writing down any symptoms or medications or any questions that you want to discuss with your physician. So you want to make sure to always have your phone, tablet, or computer ready at least 10 minutes before your visit in order to ensure that you're ready to hop onto that call. So by following these steps, scheduling a telehealth visit is really quick and stress-free. And if you ever need help, you can also always ask a family member or your healthcare provider for assistance. And then moving on, like any other online or computer-based technology, there are some dangers to it. So, but telehealth visits are designed to be very private and secure, like in-person appointments. So they follow strict privacy laws like HIPAA, and they ensure that your health data remains very confidential. And your provider will also never record your visit, but they'll just take notes throughout based on your symptoms or any conditions that you might be facing. But there are still a few steps that you can take to protect your personal information. So when you do join these meetings with your physician, you want to find a quiet place where you won't be overheard. So that can be like a home office or a private room in a library or even in a parked car. Just try not to be in a public space where everyone can hear kind of what you're discussing. You should also use a patient portal to message and make those appointment details. And then to keep your data safe online, before you enter any personal information, you should look for a little lock icon in the website address bar, which means that the site is very secure. You should also always use a password protected Wi-Fi network instead of any public Wi-Fi networks in order to prevent any data from leaking out or from any scammers kind of getting your information. And just as I mentioned, there can be instances where scammers like pretend to be healthcare providers. So you always want to confirm your appointments by calling your doctor's office directly or checking in your health portal if you're unsure, just to make sure that your data remains confidential.
Okay, so now let's get into hospital robots. This is a pretty fresh technology that's still being tested in many cases, but there are several different hospitals in the US that are adopting hospital robots. So I chose to talk about a specific brand of robots, which are called Moxie robots. And what they do is they help hospitals run 24/7 by assisting the clinical staff with non-patient facing tasks, like for example, running patient supplies, delivering lab samples, fetching items from central supply, or delivering medications. So the idea is that these robots are not supposed to replace the nurses in any way, but instead help them to be more productive and like help them with those tasks that are typically like sort of boring and take their time from
So I've been in for about 5 minutes and notified others who had emailed me the problem.
Okay,
Thank you, Bob.
thank you. Yeah, so yeah, just continuing. Yeah, so these robots are supposed to be a helping hand to the nurses and not replace them anyway. If we go to the next slide, we sort of laid out the different features of these robots. So they have a robotic arm that's supposed to help in manipulating its environment, including doors and elevators. It has a secured storage space for transporting like healthcare tools and supplies. LED eye expressions shaped in little hearts. These are supposed to be like a friendly face. I'm not too sure about that. You guys can write in the chat if you think you would be comfortable with having this robot help you out in your hospital room. But yeah, I'm not sure if it's like the most friendly face, but at least they're trying to do that. They also run on artificial intelligence, so this enables the robot to quickly learn what to do when they get to a new hospital. So they're able to get data from the hospital systems and operations, and also the patients in order to help to the best of their ability. And they also have a navigation sensor that allows them to go through the space without bumping into anything, which is also very nice. Yeah.
Like we mentioned before, if anyone has any thoughts or questions that they want to share, feel free to drop that in the chat. But next we'll go over the future of healthcare technology. So AI is being used to detect and diagnose diseases. So currently some doctors are using the help of AI to detect markers of disease or illness and to tailor treatments to patients based on their lifestyle, their genetic makeup, and different health choices that they make. So AI is currently being developed to predict health problems by analyzing each patient's health history and lifestyle. They can even use analysis of their genes to detect early signs of diseases like diabetes or heart problems. They can also tailor treatments to patients based on their lifestyle, biological makeup, and genes by helping doctors find the right drug at the right dose for patient specific needs. This reduces side effects and makes treatments more effective. It is also being used to discover and develop new drugs by speeding up drug development and helping scientists find safer and more effective treatments for diseases more quickly. They're able to identify potential drug targets, predict drug efficacy, and optimize drug development processes. AI is also being trained on various data sets and images so that it can learn to identify different patterns, features, and abnormalities in different scans. So one example of the way AI is being used in disease detection is this company called NeuroAnalytics. They were able to develop a device that helps paramedics detect early signs of acute ischemic stroke. They use AI to diagnose these, and AI has up to 94% accuracy, which is very high. And they also received FDA approval in May 2018, and they'll be trying to roll these out in different ambulances so that paramedics will have constant access to them. They're using these AI-based algorithms to analyze different scans and images, and they're being trained on these large amounts of data sets and images so that they're able to identify the different patterns and different little features in these images that might signal a disease. And so AI here uses an algorithm to find the largest blood artery in the brain and to measure blood flow in order to predict and detect the signs of the stroke.
All right, I'll be talking about how artificial intelligence is transforming the healthcare space, especially when it comes to treatments and patient care. We'll look at how AI can help predict treatment outcomes, how it supports patients through tools like chatbots, and what the future might look like with even more advanced technology. And I'll also share some real-world examples that show how it is already being used in the medical field. All right. So AI models predict responses to treatment based on the medical history, lifestyle, and genetic data. If you can look at the image on the right, for the artificial intelligence, the model takes in all these different data, the medical images, records, literature, the genetic data, and runs through already defined algorithms such as the support vector machines, decision trees, and Bayes networks. They can help provide accurate treatment plan for the patients. And one of the example is Akito's lab Scope AI. The image on the bottom left, the man in the middle is Dr. Stephen Hockman, the medical director of Akito Street Medicine in LA, which he utilized Akito's lab's AI system, Scope AI, to enhance healthcare deliveries to homeless communities. Scope AI suggests potential diagnosis and treatment options based on patients' symptoms and medical histories, which Dr. Hockman reviews and approves. This collaboration between AI and human expertise aims to provide more accurate and timely medical care to undeserved populations. And AI in patient care, AI-powered chatbots are transforming patient care by offering real-time support, answering health questions, and guiding patients through treatment options. One of the examples is San, the AI nurse chatbot, which is developed by Helpsy. Sen is a virtual assistant for cancer patients. It can be deployed directly in an interconnected fashion to connect all the people with vested interest in the quality of life of a specific patient, such as hospitals, doctors, nurses, the patient, and the patient's immediate family. Once a diagnosis is entered to the system, the Sen chatbot can help patients to navigate the complex web of requirements, treatment options, routines, patient adherent medical protocols, and other aspects of a cancer treatment. One of the future implication is the researchers hope that future models will be able to detect and diagnose anomalies all over the body and even differentiate between them. Because if right now, majority of the AI and machine learning models are trained on the patterns, so they are quite difficult to capture any medical anomalies or outlier and extreme cases. So with more data in the future, the researchers hope that the models will be improved.
Before we move on, does anyone have any experience with seeing these kinds of hospital bots in the hospital, or using telehealth, or using any of these AI chatbots? If anyone has any experience with using them or any questions or concerns, feel free to drop them in the chat. If not, we can move on. But again, feel free to chat whatever you guys want to discuss or ask any questions. Next, we're going to move on. So we have a guest speaker here who is actually a USC alumnus, and she is currently working in the industry of healthcare and technology. So if you want to introduce yourself.
I can help with that. Jenna?
Okay, thank you, Bok. Would you like to go
Anyway,
ahead?
yes, sorry for some of the confusion today and for those that are late joining. Our guest speaker is Nicole Hollis. She is an AI and automation specialist and technology advisor. As was mentioned, she graduated from USC's Annenberg School. Currently works for a company that provides emergency response and health monitoring devices for seniors. Recently, her company began providing AI-powered virtual caregiver support. As such, I think she is eminently qualified to provide a few short commentary remarks in support of the great effort that I think the Gerotech students have shown us today. Nicole, I hope you're there. I can't see you.
Yes, I'm here, Bob. Thank you for the introduction. And thank you, students, for allowing me to join you. And this is awesome. The way that you're supporting the USC community and Half Century Trojans is really awesome. And I'm just like stumbled across you all when I was looking at alumni events. So yes, I am an Annenberg alum, class of 2003. And actually that was right around the time that Facebook was getting popular. And so as part of the Annenberg program, I actually took a class called Introduction to Communication Technology that had a little bit of coding in it. And, you know, just kind of like got me interested in tech in a way that I wasn't when I applied to USC and, you know, never even thought about joining the computer science program. So that was my introduction. Right after graduation, I went into healthcare account management, starting with pharmaceutical. I worked for Pfizer right out of school, and then went through various like medical device companies, account management, sales, marketing, those kinds of responsibilities. And, you know, I kind of basically felt that, healthcare is very regulated, and those regulations protect us in a lot of ways. And so the things that I could say as part of my job, the interactions that I had with physicians, and certainly with patients, were very structured, to the point where I kind of felt like a bot. I felt like a bot, and I was like, how would I make a bot that would do what I'm doing? So I started tinkering on nights and weekends, with artificial intelligence, even though the healthcare field was many years from, being comfortable enough to adopt this type of technology. So that's how I gained experience on both sides of things. And the last 6 years, I've been split between my own AI startups, and I recently worked for a chatbot company that's based in Europe, that was mostly doing bots for financial services. So the technologies that you've seen in the presentation are out there. Just as Bob mentioned, the company I'm working with now, Electronic Caregiver, they're out there, and you just kind of have to see, what technologies make sense for where you're at in terms of your comfort level, with using more digital solutions for your healthcare. So that's it for I would say, for the introduction. I love talking about technology. I love training about technology. So I will continue to be available for you all after this meeting. So I'm gonna read these a little slow because I sent notes in and you guys made these awesome slides. So let me make sure I keep up. So yeah, it's all about data. It's all about data. And there's two sides of it. It's the data that is specifically about you, that makes sure that you get personalized treatments, and, whether that's data that you would be speaking in the past that you would just say verbally to your physician, or data that's sent electronically. We're going to talk about the importance of that data being managed appropriately. But then also, part of the presentation was about the prediction aspect of AI. And so the predictive analytics, predictive technologies that say, I think Susan, you mentioned that there are AI systems that predict the likelihood of disease, or the likelihood of decline and things like this. And so those predictions require a combination of data about a specific person, and then this training data that tells the technology these are all the ways that a disease goes from 0 to stage 4, for example. And then the technology is trying to match that trend to what it's seeing in your data. And the accuracy is definitely something that may improve over time. It is all about what data we make available to these systems. And certainly today in 2025, humans are really required to be part of any process. And I would encourage you all to trust, your eyes, your instincts, your physician's eyes and instincts, as paramount over what an AI system may tell you. We're going to be collaborating with these machines, but the solution is not to just trust them wholeheartedly and say, if the AI says this is, that I'm, my disease is going to progress, severely in 6 months, then that's the truth. That's the technology is just not that accurate yet. So always trust what you know about yourself and your communication with your physicians. Data sharing and authorization are essential. We're going to get into the details of that. And then I made this acronym, CREED. I like making acronyms. One thing about studying communication at Annenberg, it's like a language arts, communication studies, media studies kind of program. But a big part of AI is what's called natural language processing. And so it was a very strong foundation to have as AI has progressed into this, being all about language, more about language than it is about algorithms in a lot of cases. And so I'm like good with the acronyms and the puns. I got acronyms and puns for days. So I made this CREED acronym that we're going to get into about managing your healthcare data in order to get personalized treatments. Okay, so CREED. You guys, these are great slides. Thank you so much. I did not make these. you guys made these and I love it. So creed, a set of fundamental beliefs or a set of beliefs or aims which guide someone's action. So so it's like, my creed is that, I believe in autonomy. I believe, my creed is that humans will always be more intelligent than machines. Like those are some things that you might talk about in terms of your fundamental beliefs. But we can kind of just twist that a little bit and think from a machine's perspective. We're kind of playing with that word, and we want to manage our data in a way that the picture of you, the idea of you, the concept of who you are is really communicated fully to any AI system or any digital system for that matter. Who are you besides, a unique identifier? So we'll go through the 5 letters: collect data, release data, evaluate data, educate yourself about the data, and digitize. So we'll go from there. Okay, I'm scanning that, Jenna. I'll come back to that. So collect. So, there's 2 ends of the spectrum. There's the end of the spectrum where maybe, you grew up in one town and you went to school there and you went to the same doctor and, you skinned your knee, you went to that doctor, you got LASIK, you went next door, and all your data is in a very easy place to gather and identify. Or you could be someone that's moved around, you've seen doctor while you were away at school, you moved to different states. So, our healthcare data, when you encounter new physicians and new organizations, they own that data. They collect it through their machines, their imaging machines, their electronic record systems, and they possess it. And so I think I heard maybe Grace mention patient portals. Those are really important in terms of accessing data that is held by a healthcare entity. It is by law that you should have access to a patient portal for any healthcare provider. And you should be able to access your test results, doctor's notes, meaning the notes that they've written about you or typed about you, through those portals and be able to export that data from those portals. So that's an exercise in itself to make a list of everywhere that you've been, that you've encountered a licensed professional, and request those records. You may have access to a portal where you can export, or you may have to ask for access to a portal, or you may have to, in some cases, because digitization and all of this is in different stages for different companies, you may have to go in person and fill out a form to request your records. But in terms of providing data about you to a technology system, first thing you got to do is collect it and have it in your possession. So preventing information gaps, if you had a physical for 10 years in a row, but you only have access to 5 of those years, then it causes real problems for an AI system to just have nothing, data, nothing, or data, nothing, data. It causes it to fill in the blanks by itself and kind of guess about things. It's a common practice in healthcare data to just carry over a value. So if you had a 98.8 temperature for every day of a month, but you skip 10 days, it's a very common practice in healthcare to just fill in that same 98.8 for the missing days. So the more that you can address any missing information, the better for identifying patterns accurately, and informed communication. Yeah, and so I'm just making sure that you have the data, that in the event that you want to share it, that you have it in digital form for the most part. There are places that will give you a piece of paper that you would then scan. Does that make sense? Just nods will help me make sure I'm staying on track. Anyone? Yeah. Okay. Thanks, Jen. Okay. Next one. Okay. So while you're at it, when you think about, you make this list, of places that you have data on file, and you want to make sure that you go collect a copy of that data for yourself. At the same time, you want to think about who else you want to be able to access that data. So think about an urgent care. And so if it's an urgent care, maybe you just want to make sure you get the x-ray that they took that day and you have those records. Not really a scenario where you would necessarily plan to be back there. But if it's a hospital, when you go get your hospital records, you may want to make sure that your significant other or a parent has access to your medical records. And so you'll want to sign a release and put their information to say that they are able, that you give the entity, the hospital, the doctor's office, or whatever it may be, you give that entity the permission to release information to this individual or this app or this technology. And so without a release, when it's a person-to-person thing, that means if you are unable to communicate for yourself, maybe you're just under anesthesia or something, they do not have permission to even say, oh, she's doing well, or yes, there were complications, but he's fine now. They don't have permission to say any of that. That's private information, right? I'm sure you guys have talked about HIPAA in some presentation. So of course, those laws are taken very seriously. You have to give express permission. And then in the case of technology, it's usually going to be an electronic release. And so you just want to be mindful if you start using a new digital health technology, there's going to be at some point some checkbox or drop down that says, do you want to share data with us? And ideally, there's some really easy way to request data and share it with any app that you'd be using. But without a release, you should not expect, if you hear that a hospital that you visit is, at the forefront of AI, using AI to help with patient care, that doesn't apply to you unless you've released data to, allow them to use your data in a system like that. It might be one of those terms and conditions opt-in things that you might not notice, but at some point, if anyone is using AI on your data, you must have given them permission somewhere. You should have, must have, would have. And then reduce stress for loved ones, just the idea, again, person to person. You want people to be able to know how you're doing in any emergency or any medical incident, and so doing that release. And emergency care, again, if you can't speak for yourself and there's a life-saving or time-sensitive treatment, there you would need someone to basically have the permission to say, you can tell me what's going on with them, and then I can give you the permission to just do your job, because a healthcare provider is in the business of saving life and preserving life. And so it's a different thing to have someone make medical decisions on your behalf. It's another thing for someone to be able to say, hey, you're related to this person, or they've released information to you, and we have a cut and dry, that's not good. We have a very clear decision in front of us, and we just want to let you know what's happening if this person has allowed you to know what's happening. So all those reasons, all those scenarios require a release to be completed. So that's the R in CREED: collect, and then at the same time as you are engaging with those organizations, decide where you want to put releases on file. Okay, and we can go on to evaluate. So this is like maybe one of the most important ones. So you get the data, you make sure that the organization can release it to certain people. Now you have it in your possession and you're the source of truth. You're the source of truth to say, okay, I went to that urgent care for a broken arm, but when I look at the data that they gave me, it says it was a broken wrist. Oh, that's the kind of thing that's not going to be caught by the providers at the facility because they have so much going on. And there's just not the scenario where that would come up often for you to verify that. It can be something like that maybe wouldn't affect a future treatment, or maybe it would. You can imagine if a different medication that you're not actually taking gets into your file, or vice versa, things that you are taking are omitted from there. So you're the source of truth in terms of what's accurate and complete about a medical record. And it's a very worthwhile exercise to collect all those records and take a good look at them. This is very, very, very common for there to be errors, omissions, typos, drug names that are similar, that were selected from a list, the wrong thing was selected. People are very busy, understaffed in some cases. So this is a really important step to evaluate those records that you collect from each entity, because you don't want them to be used by a technology system, especially an AI system, if they're not accurate. Okay. So you can prevent future errors. You can ensure that you get proper, appropriate treatment for whatever may be going on. And kind of data discrepancies at the top of that is that patching those is to your benefit in every way. And then educate. So you'll come across, you're looking at all of these things. It's easy to see, okay, broken wrist versus a broken arm. But of course, there's lots of medical terminology in the medical records. And so, your mission, if you choose to accept it, is to really go through these things and have have one window open with a PDF of your most recent physical, the doctor's notes and whatever test results, and then another window open of like looking up terms that you may not recognize, or drugs that you may not recognize. So maybe it's the generic name and you only recognize the brand name, and then you go look it up and you say, oh, okay, yeah, I know, I take that, I think about that. This is also part of the educate and evaluate steps go together, and that as you go down kind of the rabbit hole of understanding every word that's in your file associated with your health, that you'll go and look things up and maybe go back to the doctor and say, actually, it says that I was taking oxycodone, but it was actually OxyContin, or it's pretty, serious drugs, right? But you can imagine how something like that would need to be corrected, and you're the only one that can do that. Ask as many questions as possible. You don't want to try to evaluate everything from the internet, looking up things that don't look familiar. So it's certainly a great time to use that patient portal and send in questions, formulate questions about what's in your health record and type those up and send those via the patient portal to get answers from your healthcare provider or during a medical appointment. So that's it. And, just really take your time with that and be thorough to understand everything that's in the record. There's no reason that there should be anything in any health record that is just completely foreign to you. And then digitize. So we're kind of like, these scenarios we're thinking about is, that the data exists somewhere in digital form. And for the most part, that's true in terms of like when you go to the doctor and you see them typing, or, they take they have a lot of times they have a transcribing system running so that you guys are talking. And then now it's relatively popular for AI to be transcribing, or maybe they're typing as they go. But when you collect the records and then get your own copy, there was a time where they would give you a CD, and that still does. If you want like a copy of an MRI, for example, you might actually get a CD-ROM from a radiology center. Sometimes they will, depending on what it is, it'll be exported to you, or usually like a secured link that you'll get where you can then go to the secure link and download a digital file. I did recently collect a record from a women's health physician, that I had visited, and I had to go in person. They could have mailed it to me, but I went in person because they literally took their like paper file off the shelf. It was one of those offices that has all these paper files. They took the paper and said, okay, you're moving out of the county and you want your records. Here you go. Here's your folder. And it had like, about a dozen or so papers in it. And so in order for any future AI system or digital health technology to utilize that information of my encounter with that women's health provider, I would then need to scan those papers, those documents, into a digital form, like a PDF that can then be scanned using optical character recognition, OCR, to take the data from the PDF and then put it basically into a more readable format for an AI system or to any other digital system. So the more that you make sure that you have digital versions of everything, the better that it can be useful for the types of things that you've heard about today. Is that the last one? Yeah, so CREED, you can kind of keep this in mind when you're looking at healthcare technologies. Things have gotten, the advancements are absolutely amazing. I mentioned Electronic Caregiver, the company that I've been working with. They have been making health monitoring solutions, personal emergency response devices like the Life Alerts. And that used to be, I was looking at a coupon book just the other day and I saw like the original Life Alert company with like an advertisement in there. Like those are still active, but that used to be kind of like, when you get to that point in time where, you could have that type of emergency happen to you, then that's when it was time to invest in a digital health, system or technology, because it's like this life or death matter. And now technology has advanced so much that, like an Apple Watch, for example, you can record your vitals and things 24/7, get a reading on how you're sleeping and all this. So the cost of technology and the accessibility has changed dramatically, that it's no longer that you would engage a digital health solution just in terms of life or death. This is about wellness. Now we want to be really focused on using these products for wellness. So as you evaluate your options for wellness technology instead of emergency technologies, think about where is the data, where is that sleep data that a health watch that you may be wearing? Where is that? Where are you viewing that besides on the watch? Where are you logging in and viewing that? And can you export that graph of showing how your sleep has been for the last month? Can you get that out of there so that it can be used for a different system? If you can't, then you might want to use a different health watch or whatever that may be. Collect the data, those release options, can you share that data? Just sticking with like sleep data, if you want to share that with someone else, how easy are you able to release the information to them? Evaluation, making sure that like there's no anomalies that you don't understand why they're there. It would be great if you didn't have to have one window open of your data, another window of Google looking up different terms, or is this normal sleep, for example. So a health solution that has education built in is also helpful. And then digitization requirements and capabilities, meaning what is required in terms of providing data. So if you have a system that's going to analyze your physicals from the last 5 years, what format do you need to provide that data in? Is a PDF okay? Do you need to get some other like export, like a Excel, like a CSV file? You want to understand that. And the data that it's collecting, again, if you have a graph of your temperature or your sleep, can you export that in a digital format? So that is everything there. I'm just reading this note, Jenna. You said the first 2 points. I'm not sure what the first 2 points were now. That didn't have slides. What were you referring to?
Oh, it was the personalization of medicine and data sharing, but I think you've already covered them during the
Okay, cool.
Done.
Answer any questions?
Yeah. Are there any questions for Nicole or for the Gerotech students relative to their general presentation that was earlier? If not, I'd like to thank everybody for their understanding for delayed on some of you getting onto the system. We'll try and resolve our issues before the next workshop, which happens to be on April 26th. You might want to make a note, save the date. The presentation from Gerotech will be entitled Digital Communications, which is all about iMessages, and Android messages, as well as a lot of information on email, covering in general more detail than just sending messages via your phone. Watch for an email or the alumni newsletter or the Emeriti Center website will have information this coming week on how to register for that. So I'd like to add my thanks again to Nicole and to Jenna and the other presenters today. It was an excellent coverage.
Thank you all so much for attending.
Much.
Thank you, Jenna. I think we're done.
Yeah, Susan, I see your question here. Maybe I can send a follow-up maybe document with a little bit more details about the CREED acronym so that people have kind of maybe more some actionable steps. That's
Yep.
helpful.
Yep.
I'll send you that, Bob.
Yeah, send it to me. Thank you.
Okay.
Thank you guys. Have a great weekend.
Okay, let's hope the women win it this evening.